welcome back to Orientation for Clinical Research. We're going to talk today about literature reviews and how to find good literature and how to use literature reviews as research. Now, for finding the literature, two great suggestions for you. First, talk to your librarian. Your local librarian, either at your medical college or within your clinic, will have great suggestions for searching. They will be able to help you find obscure papers or get access to papers that you wouldn't otherwise have access to. And they'll know the right tools for you to use and what are available to you. Second, when you're thinking about search strategy, it really depends on the purpose of your search. You're going to use a different search strategy if you're just getting background information or if you're doing literature reviews as research. But a few tools that I like that are a little less known. First, Connected Papers is a tool that's free for a certain amount of use, in which you can upload one paper and it will find papers with similar citation patterns and build you a network of the literature on that particular topic. It's very helpful when you're trying to develop an understanding of where the field is. Jane is also a really useful tool. It stands for Journal and Name Estimator. If you have a sentence or an abstract or a title and you want to find out what other papers are similar to this, or what authors are writing in a particular field on the similar topic, Jane can help you find authors, find papers, and I often use it for finding journals to publish in because it suggests journals that have published similar work in the past. Now, we can't talk about medical literature reviews without talking about Cochrane. Cochrane is a nonprofit based in the UK, started in 1993 to produce systematic reviews for medicine. It also produces plain language summaries of results. As a clinician, you have probably in human medicine used Cochrane reviews to understand a particular topic and what is known about it. Cochrane has also developed GRADE, the Grading of Recommendations, Assessment, Development, and Evaluation. That gives you an idea of how much confidence is there in the resulting estimated effect that they are producing for you. So they're not just telling you what is our overall estimate of how well this treatment works, but also how confident are we in that estimate. It's very important to combine both the estimated effect and the confidence in understanding a Cochrane review. Now, when we talk about searching databases, we need to know which database to use, and that really depends on the topic that you are doing a literature search on. If you're doing human medicine, PubMed is a great source. If you are working in veterinary medicine, PubMed may not have every article that you want. And if you're working in a field that involves ecology or social science, PubMed may be really lacking. So you want to think about which database is best for your topic. You may also want to consider using the gray literature. Gray literature is what we use to refer to government reports, industry publications, anything that's not peer-reviewed publications but is out there and searchable. You may also want to consider searching trial registries. Trial registries are where people who run clinical trials will enter in what clinical trial they're running, how they're running it. They'll have their protocol in there before they run the trial. That can help you identify trials that are already in progress on a particular topic so that you know who is doing what in the field and how are they doing it. You also have to think about how to search a database. String creation is really important. A search string is the combination of words that you use to ask for a particular type of information. These tend to be standardized when we're using literature reviews as research, and you want to record the time in which you used a particular string so that you know what literature was available. This is part of your methods. String creation is a bit of an art form, and this is one reason that you really do want to reach out to your local librarian because they will have excellent advice on how to actually ask a particular question. I have in this picture an example of a search string for Scopus, and you'll see that it is quite complex when they're trying to get at a more complex topic. So in this case, the carbon footprint and climate change impacts on the healthcare system. That's a big topic. The search string gets a little complicated. Now, when you are doing a literature search, you need to manage your references. Do not try to do it manually. It's not a great idea. Make your life easier. There are reference managers that are out there, ones that I have personally used, EndNote, Mendeley, and Zotero. I personally use Zotero at this point. If you are somebody who likes to work in LaTeX, you can use a BibTeX file to manage your literature search, but just have a reference manager that keeps all of your references in one place and that can help you when we get to the writing up your results section. If you are doing a systematic literature review or some other form of literature review as research, there are review managers out there that are really helpful for keeping track of everything that you're doing. I have used Covidence in my team, but there's also Rayon and Catchy. These are wonderful tools. Check with your librarian to see if you have access to them. Some institutions will have institutional memberships or discounts. So, I've mentioned literature reviews as research, but let's get into this. A narrative review is a literature review that tells a story. For example, this is from a narrative review on the epidemiology, diagnosis, and emerging therapies for Lyme disease of the Northern Hemisphere. It's not a systematic search of the literature. It's not purporting to tell you everything that's in the literature. It is simply trying to tell you a general story about what we know about a particular topic and produce some useful information specifically for clinicians so that they can be caught up on where we are with Lyme disease. This is very helpful, especially if you are a clinician or if you are a grad student or a resident and you are trying to get caught up on a topic really quickly. Narrative reviews are incredibly helpful. They are a good way to tell people where we are in the literature. They can have holes, though, because they are not, by their nature, systematic. A scoping review uses a formal search approach to ask a fairly broad question. So for this example, we have the clinical and economic outcomes evaluated in Lyme disease. It's more of a scoping review. It's going to tell you what different outcomes have happened. A scoping review will give you an analysis that involves what types of sources of evidence are there out there? How well are the different sources of evidence being presented? What sorts of results are there? It gives you a synthesis of the results and the summary of evidence, but it's generally a wider question, not a specific, how well does this treatment work for this condition, but more of a, what treatments are available for this condition? Or not, what is the likelihood of this particular outcome of this disease, but more, what are the general potential outcomes of that disease? So scoping reviews tend to be a bit broader. They are closer to a narrative review, except that they use that formal search approach. So they have a defined search string and they use defined databases and they share their methods as well. Systematic reviews are also going to use this formal search approach, but they're going to ask a very narrow question. So in this example, the efficacy of antibiotic prophylaxis for the prevention of Lyme disease. Very specific question. It's one treatment and one outcome. The analysis will also provide the characteristics of the sources of evidence and an appraisal of the sources of evidence and the results, but it will synthesize the results and summarize the evidence on a much smaller topic than within a scoping review, which may ask a more general question. A meta-analysis can but doesn't necessarily follow a systematic review. A meta-analysis requires a systematic review. Systematic review does not require a meta-analysis. The meta-analysis is looking for the median effect size across all studies. So it's going to look at a particular question, gather all of the information across all studies that have asked that question, and come up with an overall result. It will also look for sources of heterogeneity across those different results. So it may say, okay, what's the average treatment effect? But then, does the treatment effect differ depending on the age of the participants or on the country in which the study was conducted? So it will look for those potential sources of heterogeneity. It may also use a meta-regression. So if the effect size is not homogeneous across the studies, it may say, well, is there a variable that is associated with the effect size that we can use to estimate how that particular variable may affect the overall treatment effect? You will also see sensitivity analysis. Well, they'll see how much do each individual study participate in the overall estimate of the outcome. They will look for bias due to missing results. Maybe there are studies that didn't get published because they didn't have significant effects. So is there evidence of a publication bias? Is there evidence of a limitation in where the studies have been done and what populations the studies have been done in? And then, as we mentioned with Cochrane, the grade approach, this is where the grade approach gets applied, that you can do a confidence analysis of how confident are you in that overall estimate. Now, just to mention for the median effect size, this may be a fixed or a random effect. If you are doing a meta-analysis, I recommend that you reach out to a statistician to help you with the analysis results. Now, when we're doing a literature review, we will often use what we call the PICO approach. This is a helpful way to frame your analysis within a particular topic. So the P stands for the problem or the population, which asks what are the characteristics of the patient or the population, and what is the condition or disease of interest. So you're going to limit yourself to a particular condition or disease of interest or a particular population. The intervention for I is asking what is the treatment that you're looking at. The comparison for C is what is the control that you're willing to accept. And then the outcome is very specific to the time, location, any other details. Do you have similar measurements? So specifically for a systematic review and meta-analysis, using the PICO approach, make very clear what studies will you accept and what studies will you not accept. So for example, in that example of a systematic review and meta-analysis I showed, the problem was Lyme disease, and the population was people who have had an Ixodes tick bite. The intervention is chemoprophylaxis. The comparison was placebo, and the outcome was an unfavorable event with seroconversion. So it very clearly makes the inclusion and exclusion criteria for that particular study. Using this PICO approach, we can make a nice, clear, systematic review that will help us to understand the true evidence behind a particular treatment. In this case, chemoprophylaxis for Lyme disease. I hope this is helpful for you if you're considering using literature reviews as research, or just for your literature review as part of your research program. If you're considering a literature review at all, I recommend that you reach out to your librarian and get their advice. They will be an incredible help to you. I'll see you in the next video.